They're among the world's most controversial drugs. Not coke, heroin, or crystal meth, but anabolic steroids.
Steroids are incredibly effective.
Scientists realized the potential of anabolic steroids soon after they appeared. In 1939, German scientist Adolf Butenandt won the Nobel Prize for Chemistry for his pioneering work on testosterone. Hitler refused to let him accept the prize. But from World War to the Cold War, Germany pioneered steroids research. At the 1976 Olympics in Montreal, East German athletes won 40 gold medals, including 11 in women's swimming.
During the 70s, the East Germans had a phenomenal record in the pool. And it wasn't until about 20 years later when it finally emerged that they had a drug program in place and they were just taking all the medals, literally.
Guy who eats badly, sleeps badly, smokes, drinks too much alcohol, misses half of his gym workouts, and takes steroids can blow away the most dedicated, most gifted athlete who does not take steroids in terms of sheer muscle gain.
Athlete trains intensely. Natural testosterone levels in the body drop precipitously, sometimes to that of a castrated man. The body also releases another hormone called glucocorticoids to reduce inflammation. But glucocorticoids have a second effect. They are catabolic, meaning they break down muscle tissue. It's a double whammy against the muscle, a drop in testosterone and an increase in muscle-wasting hormone. It's speculated that steroids affect the hormone imbalance in two ways. First, they may replenish testosterone levels after a workout, accelerating muscle repair. They may also block the muscle-wasting effects of glucocorticoids. The result is a muscle that quickly gets bigger and stronger. That steroids can push the physiologic limits of the muscle, making it bigger, faster, and stronger than it could get naturally.
These drugs will take you places that you can lift for 50 years and you'll never get to naturally. They're that potent.
Experts agree the abuse of steroids comes with several undesirable side effects. Men may experience a number of short-term cosmetic changes. They can include severe acne on the back, as well as on the face. Gynecomastia, the accumulation of fat under the nipples, causing the breasts to swell. And even testicular atrophy, the shrinking of the testicles to half their normal size. For women, the androgenic or masculinizing side effects are more pronounced, including male pattern baldness, growth of facial hair, and even a permanent deepening of the voice. The breasts may also shrink and the clitoris enlarge. Other side effects are debatable. One is a spike in aggression from steroid use, known as roid rage. Roid rage is exaggerated.
You give me State College, Pennsylvania, in Ann Arbor, Michigan, on a football Saturday, and I will show you as many cases of alcohol-induced rage as you will see in the United States in 50 years from anabolic steroids.
Steroid users who often mix other drugs, including growth hormone, insulin, thyroid hormone, and amphetamines.
So you have this cauldron, this witch's brew, and then people ask me, well, anabolic steroids is in that cauldron, what effect do they have in combination with all these other drugs? I go, got me. But it's interesting because it's always the steroids that are pinpointed as the culprit.
In some of the studies that we have done, we have encountered guys who are taking the equivalent of 100 times the natural output of testosterone. In other words, if you figure that the normal male testis manufactures between 50 and 75 milligrams of testosterone a week, we have seen guys who are taking 5,000 or 6,000 milligrams of testosterone or its equivalent per week from injections or pill.
But there is a safe way to take steroids.
But not without a doctor's supervision. Doctors prescribe anabolic steroids in what they call a physiologic dose, the amount of testosterone a man produces naturally.
I use them in my practice as well. I use them for men, usually older men, who lose the ability to make their own testosterone.
Other doctors prescribe steroids to treat muscle loss, anemia, stunted growth, and delayed puberty. Anabolic steroids are simply synthetic versions of testosterone, the primary male hormone. In short, they're man-made versions of natural testosterone produced in a lab instead of the body. Congress held hearings on outlawing the non-medical use of anabolic steroids. Those opposed included the American Medical Association, the Food and Drug Administration, even the Drug Enforcement Administration. All testified that steroids weren't addictive and didn't meet the criteria for becoming a controlled substance. Despite this, in 1990, Congress voted to make steroids illegal without a prescription.